The top thing patients are concerned about when they're considering a procedure is the scar. How long the scar is going to be, where the scar is located, how's it going to look, will I get a bad scar? Those things are normal concerns of patients. There's several things that we do that can really make patients feel much better about the scars. Patients can be educated how that is, but there's a progression. The scar, we call it, matures over time. So it goes from a red scar that's firm to a very soft scar that's skin color. The other thing that we can do with scars is to actually treat them post-operatively. We call that scar therapy. So what we do is actually do a defined scar therapy program for the first 12 months with the patient. And there's different things you can do. The most proven things are usually silicone products, either silicone gels or sheets that can be placed on top of the scar. But they were very effective at speeding up that maturation process. It may take 2 years for the scar to fully mature, but usually by 9 to 12 months, the scars look quite good. The good thing with what we do in plastic surgery is most of the time using the proper surgical technique coupled with that scar therapy, the scars are not a concern with patients after the procedure. There is a very small percentage of patients that can have what's called a hypertrophic scar. Patients usually call this a keloid scar, but hypertrophic is probably the better term, where it's a thickened scar. And there are some things that we can do for those patients in terms of treating that with other products or injecting it to help the scar. And generally, after those treatments, again, the scar will be very good quality long term. It is important for patients to know that there's always going to be a small remnant of that scar there. No matter how good the scar is, it's not ever going to look like no scar, but the goal is to get it to look like almost where you can't see it.